Telemedicine, 480, page number. So telemedicine, according to WHO, World Health Organization, telemedicine is defined as delivery of healthcare services where distance is a critical factor, okay, by healthcare professionals using information and communication technologies for exchange of valid information, okay, because there is distance and in person, if the physician or the healthcare providers can't meet the patient, okay, to compact the distance, what all means you use to reach out to the patient without physically meeting them, okay, that comes under telemedicine. Okay, but there are various technologies for that, for diagnosis, treatment, and even for prevention of diseases and injury, research, evaluation, continuing education for healthcare providers, for doctors, nurses, okay, webinars, web conferences, okay, that also comes under telemedicine, all in the interest of advancing health of the individual and even the communities. Okay, the motto here is that individual's health along with individual community health, okay, and health education, and any advances in the any advancement in the medical technology that can be spread in the community. That is the main motto of telemedicine. So that's a definition of telemedicine given by WHO. So telemedicine is essentially the combined use of both information technology and telecommunication to provide health services. Okay, or internet also in today's age, internet also comes under this information technology. The rapid advances in information technology and telecommunication technology are revolutionizing life and business around the world. Okay. The impact is also being felt in healthcare sector with many new applicants of this technology. In healthcare also, in the past 1 decade, there is a big jump in how internet is used, okay, in treatment, diagnosis, giving healthcare advice, communication. Okay, there is a big jump in the past 1 decade. This can be very helpful in developing countries like India, where accessibility to healthcare is again a situation that we have not completely solved. That's a problem that our population face even today. So, what are the challenges that we can compact with telemedicine? Okay, these are the challenges that are already existing. Okay, and how telemedicine is helpful in these scenarios. So, patients who have to travel long distances to just get some medications done or get their medicines delivered or consultation done. Okay, to avoid this long distance travel, telemedicine is helpful. The non-availability of transport facilities during odd hours, okay, travel cost, and not every time you will have bus services or public transport services. They work on specific time durations. Okay, when you have an emergency, you may not be able to access public transport. So in that case, what will you do? Okay, that so telemedicine is an option. Okay, travel cost, traveling is also expensive. Traveling to some other place, staying there, food, okay, living accommodation, food expenses, these all are a big cost apart from healthcare expenses. Okay, to avoid that, telemedicine can be helpful. Lack of all weather roads or simply roads in India. Okay, in India, most of the roads that we have, we can't call them roads in monsoons or after 1 year, even if it is a tar road, okay, after one rain or so, it will just vanish off. Okay, road works are not done properly in India. Okay, so in that situations as well, it also affects the population on how to travel. Accessibility of good roads are also important to reach till healthcare system. Okay, hospital is overcrowded and there is an appointment system. Non-availability of a specialist at community health center or even district hospital. Okay, if you don't have specialist, They and specialists can only be reached from metro cities. Okay, in that situations as well, specialists can do their communication at CHC. They can have a scheduled appointment through telemedicine. Okay, so these challenges can be compacted with the help of telemedicine. Technology, information can be stored and transmitted as either analog or digital information. I'll show you the image of analog and digital information. Analog information is like radio signals. Okay. It depends on, it has frequency, wavelength, and it's a signal. Okay. You need a transmitter. You should have a receiving end to catch these signals. Okay. That is analog information. Digital information, everything is in the language of ones and zeros. Okay, every information is reduced to a series of discrete numerical values. That too, it's a language of the computer. Okay, so in ones and zeros. So only the computer understands the language of ones and zeros. Okay, and everything digital can be computerized. So this is how analog and digital signals are. Analog signals, you can see there is a varying frequency. Frequency is not always the same. There is a frequency, wavelength. Okay, both the transmitter and the receiver should have the same wavelength and frequency. Only then it can catch the signals, radio signals. Okay, so telephone, electronics, radio, these all work under analog signals. Digital signals, you can see here, it's in the series of 1 and 0. Up is 1, down is 0. Okay, everything is in the same frequency, ones and zeros. So all your notepads, iPods, mobile phones, laptops, computers, okay, all these work on digital circuits. Okay, then transmission technologies. Transmission technologies, you have wires and cables. Obviously, to connect two devices, wires and cables are required. Copper wires are available. Most computers in healthcare facility are LAN connected. Okay. Then you have fiber optic cable. Okay, this is the glass fiber. Optic cables are made up of glass fiber, very thin, very fine glass fiber, and that can only carry digital signals. Okay, fiber optic cables cannot carry analog signals. Okay, only digital signals can be sent through it, and they can a large volume of information can be sent through this fiber optic cable. Okay, digital cable. Analog cable, you can't send large volume of information at the same time. Then radio based technology, radio waves are used. Okay, fixed equipments are required at the transmitting end, receiving end. That are radio signals. Transmitter and receiver is required here. Microwave links, it is used to send digital signals to point basis. Okay, up to 50 kilometers, microwave links can work, not beyond that. So in a single town, okay, a town, if there is a connection of PHC, CHC, some private hospitals, they want to be interconnected within a town, okay, within a township, microwave links can be used. Then satellite technology, it can reach anywhere on the earth. You send signal to the satellite will send that signal to anywhere on the earth. Okay, that is satellite technology. So these are the transmission technologies, how you can send information and receive information. Then you have networks. Networks, different types of networks. First is LAN, local area network. So in this network is used to connect all digital devices like computers, okay, in a localized area. All computers in one hospital will be connected to each other through a LAN network, okay. Then you have WAN, that is wide area network. Just as the name suggests, it will cover a wider geographical area. So entire town can come into this setup. Various hospitals can be connected to each other within a district or even a state. Okay, wide area network can connect different hospitals. Not in local area network, just one hospital. Each and every devices in the hospital are interconnected. Wide area network, different hospitals in a same district, okay, or a state can be interconnected. Then you have the public switched telephone network, PTSN. It can be used to transmit voice, okay, by using any modem or landline. Landline is also coming under the PTSN. Voice can be transmitted. No other data can be transmitted, just voice can be transmitted. Then you have private automated branch exchange. Okay, BSNL comes under this. So this is used to switch calls between telephone extensions like reception. Okay, reception or the telecommunication department in a hospital. It works on this. Okay, all the calls will come to the reception. The reception people will connect your call or forward your call to respected departments wherever you want to reach. Okay, so they collect all the calls and they connect all the calls to wherever it is required, forward the call to wherever it is required. Okay, so that is the private automatic branch exchange. Then you have internet. Internet is like, it's invisible but it is there. Okay, email services, all internet services, access to world wide web, www. Okay, that is through internet. Without an internet you can't mail. Without internet you can't access the world wide web, www.coms. Okay, web pages. So these are the different types of networks. Then you have end user equipment. So you are sending one signal, but there should be a receiver at the other end. And the receiver should have certain equipments on their end. Only then they can receive your message. Otherwise, your message will be lost, okay, in the atmosphere. Okay, so you are transmitting the message, you are sending the message, but the receiver, the end user who is supposed to collect the message, they should have certain equipments with them. Okay, so the first equipment is to have a telephone. Okay, it's a well-known device for two-way communication. Okay, telephone. So receiver, the person who is calling should have a phone. The person whom you're trying to connect to also should have a phone. Only then this is a two-way communication. Then fax. Again, the receiver and the sender, there is a unique fax number. If you send the information to that number, only then they can receive it. So a fax machine should be available on both the end. Okay. Then video conferencing again, if somebody has a Nokia phone, if you remember the old phone, okay, that is not viable for video calls. Okay, the digital phone that they had earlier without that screen and all, touch screen and everything. Okay, you can't even take if camera is not available, you can't do any video calls. So in video conferencing, it is similar to telephonic conferencing. In addition to that, picture is also transmitted. So is the audio visual transmission is also done. You can do a lot with video conferencing, video camera, microphone, communication. You can guide another doctor how to do a surgery. Okay, for these things, video conferencing is used. Then television, it is not interactive. It gives you information, but only rarely certain channels. If they're running certain toll-free numbers, only then you can reach out to the television channels, okay, and have a talk with whoever is host or whoever is the guest. Otherwise, if you take any random channel, you can't reach out to them. They can reach out to you. Mass media communication is taking place there, but it's rarely two-way. Television is rarely a two-way communication. Then you have radio. Again, it is not interactive, but it plays a major role in mass communication. In radio also, in some channels, okay, you can call them up. They give you a number, you can call them up, discuss with the RJ, whoever is the radio jockey, you can discuss with them or have a discussion with the guest whom they have, whom they are addressing. Okay, so that is radio communication. Then computers. Computers are capable of storing, processing, and printing large quantity of data. Okay. So the storage in computers is quite vast. A lot of information can be stored in a computer. So this is about the end user equipment. Then you have the internet services. Electronic mail, that is email, that is one main service in internet. So you can send a lot of information through email. Lot of files can be sent, but not large file. Email also has a capacity, not big volumes of file can be sent, but at the very same time, okay, within milliseconds, you can transfer information in form of files as well. That is the use of email. Okay. World Wide Web, www, that is web pages. Okay, this is a system that is organized on worldwide basis. This page contains a lot of text, graphics, animations, audio or video forms. Okay. Web addresses are also available. So that comes under the World Wide Web. So application of telemedicine in healthcare. In healthcare, which all area telemedicine plays a major role. First is the general consultation, general information of prevention and control of diseases. Okay, that can be sent through telemedicine. Like for example, during the COVID pandemic, okay, how did the public get to know they have to wear mask, they have to keep a distance, okay, they have to follow quarantine? How did the public came to know? Because the healthcare system and the media, they joined hands, okay, and continuously they were delivering health information. Okay, what medications to eat, what kind of food to eat, how to keep themselves healthy, hygienic, okay, the importance of hand hygiene. Okay, these all things were given to the general public through telemedicine because media was involved here with healthcare. Then teleconsultation can be done if patients can't reach out to the physician or consultants in person, and if there is an emergency, teleconsultation can be done. It can be done even between medical professionals. It's not compulsory that only patient can reach out to a doctor. Doctors can also reach out to senior doctors or specialists for their opinions, okay, for guidance. Then you have diagnosis and reporting. So reports, if you want to collect your laboratory reports, you have given your blood sample, you have to collect your lab reports. You don't have to go to the hospital in person. Nowadays, they send you in WhatsApp. Okay, they email you or they send you on WhatsApp whatever your report is. Okay, or whatever the diagnosis is, the hospital can send you to your personal contact. That is also a use of telemedicine. Then accessing health information when the internet is readily available. Okay, you Google certain disease conditions, what to do, whom to consult, make an online appointment booking. Okay, for all those, telemedicine can be used, internet can be used. Continuing medical education, a lot of online webinars and all are conducted. Okay, now Zoom webinars, Zoom conferences are conducted, which help the doctors to continue their medical education even without traveling to specific places for to attend a conference. Earlier, you have to travel to certain areas, certain cities where a conference is being conducted. But nowadays, online, just by logging into the Zoom webinar, or you can attend any conference sitting anywhere in the world. Advice on self-care. Good quality advice can be provided to people on telephone for whatever ailments or routine nature. Okay, like Practo. Practo is an application used for this online consultation. Health promotion and prevention of diseases. Mass media has a great role to play in educating people, particularly in disease like HIV and AIDS. Medical records maintenance. Medical records can be maintained, stored, and retrieved. Okay, cloud maintenance can be done. Nowadays, information can be stored in cloud, not in a device. Okay, it's a cloud information. Everything is online. Okay, but not in a device. You can, with password and user ID, you can access the cloud, download your data in any device. Then health and hospital administration. So financial management, materials management, human resource management, hospital information system. Okay, these all can be done through internet with a software, with digital equipments. Okay, that helps in making the hospital administration easier. Okay, Then managerial issues can also be sorted using telemedicine. Coordination. If a manager is absent, they can work from online. Okay, they can coordinate. They can get the work done online. Okay, so such managerial issues can be sorted. Online recruitment also takes place. Okay, in person you don't have to give interview. Online you can give interview. So these are the applications of telemedicine. So that's all for telemedicine session. If you have any queries, you can mention in the chat box.